Okay, so you know that feeling, right? When your braces finally come off and you're like, freedom, but then the retainer. And you're maybe thinking, wait, there's more.
Ha ha. Yep.
So today we're diving deep into what happens after those braces come off orthodontic retention.
Yeah, the stuff that makes those results last.
Right. And we've got some research here that might just surprise you. Turns out, those retainers, they could be hanging around a lot longer than you think.
Longer than anyone thinks, probably.
And get this, those wisdom teeth everyone blames for crowding. Maybe not the villains we thought they were.
It's, yeah, a lot more complicated than that.
Right, so let's start with the basics. What exactly is retention in the orthodontic world?
Retention. Well, it's all about keeping your teeth where they're supposed to be after you've had braces or, any orthodontic treatment. Basically, it's what makes sure all that work actually sticks.
Okay, that makes sense. But I gotta ask, there's this idea that teeth just like naturally want to shift back to their old positions, like they have a memory or something. Is there any truth to that?
Well, teeth don't have memories exactly, but there are some theories about why they tend to drift back.
Okay, like what?
Well, it could be those periodontal ligaments, those tiny fibers that connect your teeth to the bone. They might be trying to settle back into, what they're used to.
So it's like those ligaments are pulling the teeth back to their old haunts.
You could say that, yeah. Your teeth have been in one position for a long time, and even though we've moved them with braces, those ligaments might still be attached to that original spot.
That's super interesting. Our research actually lays out 8 different theories about why teeth might shift, but I think we can kind of group those ideas together. What do you think?
Yeah, absolutely.
So there's that whole idea about teeth naturally wanting to go back where they were because of things like those periodontal ligaments we were talking about.
Yeah.
And then there's the idea that maybe we should be focusing on the root cause of the misalignment in the first place. You know?
Like if it was thumb sucking or mouth breathing. Yeah.
Exactly. To try and stop it from happening again.
Yeah. Minimize relapse.
And then there's that concept of overcorrection.
Oh,
When they
yeah.
purposely move your teeth a little bit past where they should be to kind of compensate for that natural tendency to shift back.
Like aiming a dart a little higher on the board to account for gravity.
Exactly.
But you got to be careful. You don't want to overdo it.
Right, right. And then there's a whole other set of theories that are all about making sure you have proper occlusion.
Occlusion, yeah. That's just a fancy word for a good bite, basically.
Get a good bite. Oh.
Yeah, and getting that bite just right is, it's really important. If you want things to stay put in the long run, one of the studies we have here by Fiddler and Norick, it suggests that if you really nail that occlusion during treatment, you're going to see much better results years down the line.
So it's not just about straight teeth. It's about making sure they actually work well together.
Exactly.
Gotcha. Okay, and then there's that group of theories that's all about the actual biology going on, like the one about bone and tissue reorganization.
Right. Yeah, that one's fascinating.
Which, if I understand correctly, is about how your bones and gums actually need time to adapt to the new positions of your teeth.
Even after the braces are off.
So even though the braces are gone, there's still a lot going on under the surface.
Exactly.
Wow. Okay, and then there's that other theory about the lower incisors.
Oh, yeah. The lower
Where
incisors,
was-
the front teeth on the bottom.
Okay, the bottom front teeth. And why are they so important?
Well, getting them in the right position over the bone is really important, especially for kids and teens, whose jaws are still growing.
Makes sense. Growth, that's a whole other factor.
Absolutely.
And then there's that last theory that really caught my eye, which is the idea that you can't actually change the natural arch form of your teeth permanently.
Oh, the arch form, right.
The
shape of the curve of your teeth.
Okay, yeah, the shape. So some orthodontists think that if you try to change that shape too drastically, it's going to work against you in the long run.
That's the idea. It's more about working with your natural anatomy than, totally reshaping it.
Finding that balance between, aesthetics and function?
Yeah, exactly.
Okay, so there's a lot to think about when it comes to keeping those teeth straight. It sounds like understanding all this stuff is really key to making good decisions about our own dental care, huh?
For sure. And I think that brings us to the next big question. What are the things that can actually affect how well our teeth stay put after treatment, besides all this stuff we've already talked about?
Right, like what are the things that could make them shift back even if we are doing everything right?
Exactly. Yeah, so one of the biggest things is tooth size discrepancy. Have you ever noticed how some people's teeth just seem to fit together perfectly, like puzzle pieces?
Uh-huh.
And then other people, it's like there's a bit of a mismatch.
Yeah, actually, now that you mention it, I have.
So those mismatches, those are called tooth size discrepancies. And they can make a big difference in how stable your bite is after treatment.
Hmm.
There was this one study by Ballard, and they found that something like 90% of patients have some degree of tooth size discrepancy.
90%. That's a lot.
It is. And these little discrepancies can cause all sorts of problems like, crowding or spacing, even problems with how your bite comes together. It's like if your upper teeth are too big for your lower teeth, they might overlap or crowd. Or if your lower teeth are too big, you could end up with an underbite.
Okay, so those little size differences can really throw things off.
Yeah.
So what do dentists do about that? I mean, how do they compensate for those discrepancies?
Well, they have a few tricks up their sleeves. Sometimes they might create a little extra space by slightly reducing the width of certain teeth. It's a procedure called interproximal reduction, IPR.
IPR. Okay. That sounds kind of intimidating.
It's really not as bad as it sounds. It's very precise. The dentist just removes a tiny bit of enamel from between the teeth, usually less than a millimeter, and that creates just enough space to, improve the alignment and prevent crowding.
So it's kind of like creating a little breathing room for the teeth.
Yeah, exactly. And it's done really carefully so it doesn't damage the teeth.
All right. That makes me feel better. So tooth size is one thing. I'm guessing growth plays a role too, especially for younger patients.
Oh, absolutely. It's a double-edged sword in orthodontics.
How so?
Well, on one hand, it can actually help correct some issues. But on the other hand, it can also make those perfectly straight teeth shaved around.
Oh, I see. Yeah.
Yeah.
So how do dentists manage those growth spurts, especially when it comes to, keeping the teeth in place after the braces come off?
Well, they might use appliances like headgear or, functional appliances to help guide the growth of the jaw. And they keep a really close eye on how the patient is progressing and adjust the retention plan as needed.
Okay, so growth is definitely something to keep an eye on. All right, now I have to ask about the elephant in the room. Or should I say, the wisdom teeth in the back of the mouth.
Ah, yes, wisdom teeth.
Do they really mess up straight teeth?
Well, the research on that is actually kind of inconclusive.
Really? I always thought it was like a given that wisdom teeth cause crowding.
Yeah, it's a really common belief, but the evidence isn't as strong as we used to think. Some studies show they might contribute to crowding in the lower front teeth, but others show, like, no connection at all.
Huh. So it's not a simple case of wisdom teeth equal crowding.
Not really, no. It's a lot more nuanced than that.
Okay, so maybe those wisdom teeth are off the hook for now. But all right, let's get to the question I know everyone's wondering about. How long do we really have to wear those retainers?
That is the million-dollar question, isn't it? And of course, the answer is it depends.
Oh, come on. You can't leave us hanging like that. Give us something.
Okay. The thing is, retention isn't just about, wearing a retainer for a certain amount of time and then you're done. It's about actively, managing those teeth, making sure they stay put for the long haul.
It's an ongoing thing.
Exactly. And a lot of times it involves more than just the retainer itself.
Like what?
Well, dentists use all sorts of techniques to optimize bite stability.
Bite stability, okay.
One of those techniques is called occlusal adjustment.
Occlusal adjustment, what's that?
It's kind of like fine-tuning the way your teeth fit together. The dentist might make tiny little adjustments to the biting surfaces of your teeth,
Yeah.
smoothing out any bumps or high points that could make them shift.
Just like getting your teeth tailored.
Perfect analogy. And these adjustments can change over time, too. Like, at first, it might be about getting rid of any major interferences, but as your bite settles in, the focus shifts to those finer details.
Okay, so it's not just about the retainer. It's about, actively managing the bite itself.
You got it. And speaking of learning from experience, there's this amazing resource, the University of Washington's Post-Retention Registry. They've been tracking long-term outcomes of orthodontic treatment for years.
Wow, that sounds like a gold mine of information.
It is. And one of the things they've found is that long-term outcomes can be really unpredictable. Every patient is different. There's no, one-size-fits-all approach.
So even with all the science and technology we have, there's still an element of mystery.
Absolutely. The human body is incredibly complex. But they've also found that regular checkups are super important, even if you have a fixed retainer.
Really? Why is that?
Well, things can shift so subtly over time, and even those tiny shifts can cause bigger problems down the road.
So even if you think you're in the clear, you still got to stay on top of those dental appointments.
Exactly. Early detection is key. They've also learned that techniques like overcorrection, while they can be helpful, they're not, foolproof.
No magic bullet, huh?
Nope. And another big takeaway is that arch constriction, or narrowing of the dental arch, that's a pretty common challenge after treatment.
So even if your teeth are straight, the overall shape of your smile might change.
That's right. And understanding that can really help manage expectations. They also found that early treatment strategies, like some approaches, might be more prone to relapse. So you have to choose carefully.
So getting a head start isn't always the best idea.
It really depends on the individual case. And another thing they emphasize is patient engagement. Having realistic expectations throughout the whole process. It's not just about the dentist doing their job. Patients need to be active participants in their own care.
It's a partnership.
Exactly. And of course, they confirmed what we talked about earlier, those wisdom teeth, probably not the crowding culprits we thought they were.
Wisdom teeth are breathing a sigh of relief. Anything else they found?
Let me think. Oh, they found that upper teeth tend to be a little more stable than lower teeth.
So silver lining.
Silver lining. And they also saw that the quality of the treatment really does make a difference. A good orthodontist, that's key.
Okay, we've covered a lot of ground here.